Welcome to the Deep Dive.
Great to be here.
Today, we're taking a really fascinating look at what it truly means to be an expert in counseling, psychotherapy, and professional psychology.
Yeah.
We'll be exploring the ideas from a 1997 article by Scoveholt, Ronestad, and Jennings called Searching for Expertise.
Right, that one.
Your goal, as we dive in, is to really get a handle on the key factors for expertise in these fields, especially when we think about, what cognitive science tells us about expertise generally.
And what's really striking right off the bat is the puzzle this article tackles. I mean, we see expertise in music, sports. People practice for years. So the big question is, why has it even been debated whether more experience actually makes therapists better?
Yeah, that seems counterintuitive.
It does. The authors put this front and center, and it kind of forces us to think about the roadblocks to really understanding and, well, achieving mastery here.
Okay, so the first big idea, it seems, is that it's not just about knowing stuff, the cognitive side. They argue there's something bigger.
Yeah. Exactly. Bigger or maybe just more foundational. They call it the working alliance, that connection.
Right.
The positive collaborative vibe between the therapist and client.
Right, the relationship itself.
Totally. And they bring some pretty solid evidence. They mention a big review by Sexton and Whiston from '94.
Okay.
And their conclusion was clear. The quality of that relationship, it's the biggest predictor of whether the client actually gets better, more than the specific techniques used.
Wow, okay, so it's really about that human connection.
Seems like it. And it wasn't just one study saying this.
No.
No, the article points to work by Norcross and Friedheim around the same time, finding this broad agreement in the field. The therapy-patient relationship is central. Almost everyone agreed.
So it's like a common factor across different types of therapy.
Pretty much. They suggest it's the thread running through all effective therapy, no matter the theory behind it. And to really drive it home, they talk about research by Horvath and Greenberg and Cowell's analysis, too. They found a strong link between a good alliance and good results for clients dealing with all sorts of things: depression, anxiety, addiction.
So across the board, really.
Yeah, really wide range. And then there's the Krupnik study they highlight. That one sounds like a big deal.
What was special about that one?
Well, it was apparently the largest study at the time focusing specifically on the alliance, and the results were pretty compelling.
Right.
The strength of that alliance had a huge impact on how clients did. Actually, more impact than which specific treatment they got, whether it was interpersonal therapy, CBT, even meds.
More than the meds.
Yeah.
That's significant.
It really is. It suggests it's less about the what and more about the how of the interaction,
Okay, so how do you get good at building this alliance? It can't just be about being friendly.
No, definitely not just being nice. The authors argue it's actually quite intricate. It involves cognitive skills, understanding the client, obviously, relational skills, the ability to connect, empathize, build trust, and maybe less obviously, emotional stuff. The therapist's own maturity, stability.
The therapist's own emotional state matters.
Yeah, they cite Jennings's research on master therapists, which really brought out these three dimensions: cognitive, relational, and emotional, all linked.
And how do these link back to Scoveholt and Ronestad's own model of how therapists develop?
Good question. They see these three really coming together in the later stages of their model, stages 7 and 8, individuation and integrity.
Okay, later stages.
Yeah, basically, when a therapist has figured out who they are professionally, got their ethical compass sorted, then they can use their skills and build relationships more authentically.
So it's more integrated.
Exactly. The article stresses that just being smart isn't enough. You need all three legs of the stool: cognitive, relational, emotional, for real mastery.
Got it. Okay, so shifting a bit, the second big point is time. Becoming an expert takes a while.
A long while, yeah. Based on their analysis, they're suggesting something like 15 years of professional experience, thousands of hours of actual practice.
15 years. That's a career.
It is. And it's a real contrast to some older ideas, right?
Like what?
Well, they mention models like Hogan's from the 60s, which kind of hinted you could become a master psychologist pretty early, maybe even right out of training.
Huh. Optimistic?
Maybe. And they also point out how a lot of research used to focus on, the changes between your first and second practicum, tiny snapshots early on.
As if that predicts everything later.
Kind of. But this article argues real expertise comes much later, after you've really been immersed in it.
So what does that look like for a really seasoned therapist?
Well, they suggest these experts have truly internalized theory and research. It's not something they just look up anymore. It's part of how they think and work.
Okay.
They've found their own style, their own way of doing things effectively, and they've developed their own internal measures for success, not just relying on textbook outcomes.
Like they trust their gut more.
Maybe informed intuition is a better way to put it. And there's this sense of shedding the parts of the professional role that didn't quite fit them personally.
Ah, that sounds like that individuation stage again. Finding your authentic self as a therapist.
Precisely. The article really pushes back against the idea of quick expertise and credits cognitive science for helping the field see this longer developmental path more clearly.
Okay, now for the third area, which is, and well, it's kind of tricky. The challenge of actually proving experts get better results than novices in studies.
Yeah, that's a big one. Dawes pointed this out back in '94, this weird lack of consistent outcome differences. It makes you scratch your head.
So why is that? Why is it so hard to show the difference in research?
The article offers a few good reasons.
Hmm.
First, maybe the tasks or cases used in the studies just aren't complex enough.
How so?
Well, if the client's problems are pretty straightforward, maybe even a therapist who's still learning can manage okay. You wouldn't necessarily see the expert's extra skill shine through.
Right, like their CPR versus heart surgery analogy.
Exactly. Anyone can learn CPR basics, but complex surgery, that needs deep expertise, especially when things get complicated. So the difficulty level of the case matters.
Okay, makes sense. What's the second reason?
The experience gap in the studies. Often they compare, say, early MA students with slightly more advanced PhD interns.
Still relatively early career, though.
Right. The article argues that gap might just not be wide enough on the whole novice to expert journey to really show the big differences that emerge over, 15 or 20 years. They cite Stein and Lambert finding the average experience in these studies was under 3 years.
Wow, okay. So we're not comparing true beginners to seasoned masters most of the time.
Often not, no. That small gap could definitely hide the real expertise effect. And third,
Third reason.
just methodological problems in the studies themselves. How do you even define experience? Just years practice. That's simplistic. They mention one study where some novices were actually older than the experts, which messes things up, and not properly accounting for how difficult each client's case is. It gets messy.
So designing a study to truly capture this is just really, really hard.
It is. And the article suggests the real differences probably show up most with the really tough cases,
Right.
like clients with severe trauma or really difficult relationship histories that make building that alliance incredibly challenging. That's where the expert's nuanced skills probably make the biggest difference.
But ethically, you can't just assign those complex cases to novices for a study.
Exactly. That's a huge ethical barrier. So studying it directly is tough. They do mention some efforts to create better models of experience, looking at time, intensity, variety of practice. That might help future research.
Okay, that leads nicely into the fourth point.
Yeah.
Reflection. It's not just doing the work, but thinking about the work.
Absolutely fundamental. They talk about reflection, reflectivity, or their term continuous professional reflection. It's the secret sauce that turns raw experience into actual expertise.
So what does continuous professional reflection look like?
They describe it as this ongoing, focused inquiry, really trying to understand the complexities you encounter in practice, digging deeper. It needs an active, curious mindset. And importantly, a supportive environment where you can explore honestly.
Sounds a lot like deliberate practice in other fields.
It really does. They make that connection explicit. It's about how novices start out relying heavily on external theories, external models. They give an example of a structured suicide training protocol.
Like a checklist approach.
Sort of. But the path to expertise involves moving away from just following the rules towards developing your own internal domain-specific knowledge. And that comes from constant feedback.
Feedback from where?
All over. Your own introspection, critically looking at your work, supervision, obviously, feedback from clients themselves, talking with colleagues, consulting. It's this continuous loop.
And without that reflection.
You risk stagnating, or what they call pseudo-development, basically getting stuck in routines, avoiding complexity, not really growing.
So you need the drive to keep learning, keep questioning.
Definitely. They mention findings about desire and perseverance being key, and master therapists having high motivation. It's not just about being smart. You have to want to keep getting better.
It's interesting they mentioned that conference session.
Oh, yeah, the one focused on choosing an expert's theory instead of the process of becoming your own expert.
Right. It shows how easy it is to look for a quick fix instead of embracing the long, reflective journey.
A really telling example.
Okay, final point.
Hmm.
the practitioner-professor paradox. This hits close to home for academia.
It really does. The article asks a tough question. If expertise relies so much on domain-specific practice, how can professors maintain expertise if they're not actually practicing?
Yeah, because university structures, they don't always make it easy for faculty to keep seeing clients, do they?
Not typically, no. Outside of maybe medical schools, most departments aren't really set up to support or encourage a significant practitioner role for faculty. It creates this weird tension. Cognitive science says practice is key, but academia often separates teaching from practice.
What about the freestanding professional schools, the ones focused just on clinical training?
Good point. The article acknowledges they do often support faculty practice more, but they might then face challenges on the research side, maybe not emphasizing research skills as much. So it's like solving one problem might create another.
A real balancing act.
Seems that way.
Okay, so wrapping up our dive, expertise in this field is clearly way more than just book smarts. That working alliance is paramount.
Crucial.
It takes a serious amount of time, maybe 15 years, filled with deliberate reflective practice, not just showing up.
Right. The reflection piece is key.
And we see the biggest differences between novices and experts likely emerge in those really complex, challenging cases.
Where the alliance is tested, yeah.
And finally, this ongoing question about how educators in the field maintain their own expertise if they're not actively practicing.
Yeah.
It's a structural challenge.
It really is. The whole picture is much richer and more complex than just years of experience.
Yeah.
You have to consider the relationship, the reflection, the emotional maturity, all of it.
This was really insightful. Definitely changes how you think about what goes into becoming a truly effective therapist.
Absolutely.
So for our listeners, here's something to chew on. Knowing how much time, depth, and reflection it takes to build this expertise, what does that mean for how people should choose a therapist? Or how we should train new ones?
Big questions.
And maybe more personally, what kind of reflection could be most valuable for your growth, whatever learning journey you're on? Something to ponder.